Let us talk about back pain today. We all know back pain is something which every human will experience one time in their lifetime. And back pain we can have because of multiple reasons, the most common being mechanical back pain. And when I say mechanical back pain, it means that because of overactivity, or some days when you're straining yourself, or when you have sat down in a bad posture or been standing for a long time, you can have mechanical back pain. But these mechanical back pain actually will subside over a period of time. So after you rest, or after you sit, or with a tablet of painkiller, it will subside. But if your back pain is not subsiding in 3 months, it is going to become chronic, and that is called as chronic back pain. And this is the time that you need to get yourself evaluated. So now, if your back pain is there for more than 3 months, make sure that you visit a pain physician who can evaluate you properly. Now, once they come to us, we ask them certain questions, and during this history taking or checking with the patients about the question and answer, we come to a lot of diagnosis. Now, back pain, the reasons could be, the most common reason is disc problem. So we all know disc or degenerated disc, prolapsed disc, pinched nerve, all these are disc pain. And apart from that, the other causes could be because of facet joint, sacroiliac joint pain, myofascial pain syndrome, a broken bone, that is an osteoporotic fracture, or because of injury the fracture could have happened. And also sometimes musculoskeletal causes like a kidney stone or an infection in the disc, or sometimes because of your other gynecological reasons also you can get back pain. Now you need to understand that in what position your back pain is increasing and what are the relieving factor. Whether your pain is more on walking, whether your pain is more on sitting, whether your pain is more on getting up from sitting position, or bending is painful. According to that, your doctor will decide what is the cause of the back pain. And then we do certain tests like a leg raising test. We ask the patients to make different movements to identify where is the pain. And in 90% of the cases, we would also want to have a MRI to find out what's happening exactly into your spine. Once your spine pain has started, it is nothing really very serious, but it has to be taken with concern, because any spine pain in future can be really catastrophic. Now, one very important thing is presence or absence of red flags. What are red flags with spine pain? If you cannot control your urine and motion, and if there is any weakness in the leg, or if your pain is not subsiding with any kind of painkillers, these three are the red flags, and you need to immediately get yourself evaluated and get treated, because these can be really catastrophic. Now, if you have tingling numbness in the leg, or you have heaviness of the leg, or walking for few steps is painful, this could be because of your disc prolapse. And we have so many ways where we can treat your disc prolapse pain. If you have severe pain and you're unable to do your daily activities also, so at this point of time you need to consult the doctor, and they'll give you certain pills. And if these pills are helping you out, that is a good way to treat. Make sure that you are avoiding lifting heavy weights for some time, and you're not indulging with strenuous activities, and you're sitting in a proper position. Posture is good. Once your pain has started coming down, then you can go for back strengthening exercises. The best back strengthening exercises would be swimming. If you are into swimming, swimming is the best exercise. Otherwise, certain core strengthening exercises, even walking is really good to strengthen your back muscles. But if you have tried everything and still your pain is not going, and if you don't have any red flags, then the best treatment to get rid of your disc pain is getting minimally invasive procedures done by pain physicians. And these can be radiofrequency ablation, or could be epidural injections, or nerve blocks, or nucleoplasty, epiduroplasty. So there are multiple techniques which can be done on you depending upon which technique is going to suit your condition. That will be decided by your doctor, certified doctor. And these are minimally invasive procedures which can be done within 30 minutes, and then you can leave the hospital in an hour or so. But you have to make sure that only these treatments are not going to help you. Your back pain needs a holistic approach. So make sure that you have lifestyle modification, you do the exercises which have been told by your doctor. You need to maintain a good diet, and if you are into smoking, make sure you quit smoking. So these are the precautions that you need to take care if you have any back pain. So for more information, do follow our page and we'll get back to you.